When you're working with your clients, we talked about that we're always going to be coming from behind our clients and resting them up against our body for stability. When you're doing that, you have this excellent field of vision, and I want to make sure that you're really taking the time to just look through the entire dentition, all of their mouth, and make sure that you're not seeing anything that could be a sign of disease. So notice when you're brushing. Are you finding any areas of bleeding? Bleeding gums, that's gingivitis. It's an inflammation of the gums. That's a problem because it leads to bigger things, such as gum disease, where you're actually getting a lot of bone loss. So look for, if you see a lot of that fuzzy white plaque on their teeth, make sure you're brushing till all of that's been removed. Are you finding that your client has a lot of stains on their teeth? That's something that we want to pay attention to. It could be from the foods that they're eating or medications that they're on, but we want to know exactly what the cause is. Be aware if you see it, maybe a sharp edge, somebody might have broken a tooth, or if you're finding that there's an area where a lot of food is building up, maybe there's a space in between the teeth that we need to do something with. Sometimes you can add filling material. Maybe they've lost a tooth in the past and things are shifting around a little bit. Anything that you notice that would be out of the norm, anything that might potentially cause an issue for them. Sharp edges can really cut your tongue when they're biting. So we want to make sure that the clients have every opportunity to be able to eat well, to chew carefully, to enunciate. So we need overall dental health. So really be looking for any signs or symptoms. Bleeding is never healthy. If your hands were bleeding when you were washing them, you would have a problem and you would understand that's a crisis. It's the same thing when someone's bleeding in their mouth. It means that they have some sort of inflammatory process going on. That's a disease. We can take care of it at the start to keep our clients much healthier. I want you to also look for signs of dry mouth. It's very common in our very specialized population to have a dry mouth. A lot of times it's going to be because of the medications that your clients may be on. Sometimes we can switch out the medications. Certainly you can discuss that with the caseworkers and the doctors. But if the medications are working well for them, then what we want to do is find a way to replace that saliva. There's different sprays that they have on the market that we can use that are going to be an artificial lubricant for the mouth. It's kind of like a glycerin-based thing that's going to just make it easier for them to swallow. It's going to add that natural moisture feeling to their mouth, so talking is easier. As I said, swallowing is easier, but it's also going to help with chapped lips. A lot of our clients, you'll see, especially in the winter time, where their lips are really chapped, or they're chewing on their lips, or they have like a red ring around their mouth. Those are signs that they're very dry. Sometimes they'll get in the corners of their mouth, they'll get super cracked. It's very, very uncomfortable. So what we want to do is use some sort of saliva substitute. Most of those are just a simple spray. 2 pumps in the morning real quick and 2 pumps at night before they go to bed should take care of all of that.